If you've been avoiding Ozempic because you hate injections, this might be the update you've been waiting for. Novo Nordisk has officially launched a new Ozempic pill in the United States, and it's already creating a lot of confusion. Some people think it's a completely new medication. Others think it's just Rybelsus with a different label. The truth is somewhere in the middle. Today I'll explain exactly what this new Ozempic tablet is, how it compares to Rybelsus, who it may be best for, the real side effects, and one important thing many patients don't realize before switching. I'm a licensed pharmacist, and on this channel I break down medications the same way I would for a patient standing at my pharmacy counter. Let's get into it. First, let's clear up the biggest misconception. This is not a brand new drug. The new Ozempic pill contains semaglutide, the same active ingredient that has been available for years in Ozempic injections and in the oral medication Rybelsus. What changed is the formulation and branding. The tablets are now available in 1.5 mg, 4 mg, and 9 mg strengths. Novo Nordisk reformulated the tablets so they can achieve similar therapeutic effects at lower milligram strengths than the previous Rybelsus versions. In other words, the numbers are different, but the medication itself is still semaglutide. The company also moved the product under the Ozempic name because most patients already recognize Ozempic far more than Rybelsus. And honestly, that's probably going to make medication counseling much simpler. So what are the benefits? The biggest one is obvious: no injections. For many people, that's enough reason to consider it. The Ozempic tablet is taken once daily and can help lower blood sugar in adults with type 2 diabetes when combined with diet and exercise. It can also reduce the risk of major cardiovascular events like heart attack, stroke, and cardiovascular death in certain adults with type 2 diabetes who are at elevated cardiovascular risk. Another advantage is convenience. Some patients simply prefer taking a pill rather than storing injection pens, handling needles, or traveling with injectable medications. Now let's talk about weight loss. Many people are asking whether the Ozempic pill works for weight loss. The answer is yes. Many patients do lose weight while taking semaglutide. However, the weight loss effect is generally more modest than what we see with higher dose injectable semaglutide products and obesity-specific formulations. The side effects are very similar to other GLP-1 medications. The most common include nausea, diarrhea, constipation, vomiting, stomach discomfort, bloating, and sometimes fatigue. The good news is that these symptoms often improve as your body adjusts. But here's where many people get frustrated. The dosing instructions are still strict. You need to take the tablet first thing in the morning on an empty stomach with a small amount of plain water, then wait at least 30 minutes before eating, drinking anything else, or taking other medications. If patients don't follow those directions, absorption can be significantly affected. Here's the part that many people miss. The new Ozempic tablets are not milligram for milligram interchangeable with older Rybelsus doses. A 4 mg Ozempic tablet is not equivalent to a 4 mg Rybelsus tablet. The reformulation changed the dosing strengths. That's why patients should never switch products or doses on their own. Another important point: the Ozempic tablet is currently approved for type 2 diabetes, not specifically for weight loss. Many people will inevitably ask about using it for weight reduction, but that's a conversation that should happen with your healthcare provider based on your individual situation. My pharmacist perspective: the Ozempic pill is a smart addition to the semaglutide family. It's likely to appeal to patients who want the benefits of semaglutide but have avoided treatment because they dislike injections. That said, it's not automatically better than injectable Ozempic. Some people prefer the convenience of a once-weekly injection rather than remembering a daily tablet with strict timing requirements. Like most medications, the best option depends on the patient. If you're currently taking Ozempic, Rybelsus, or another GLP-1 medication, let me know your experience in the comments. And if you enjoy pharmacist-led medication breakdowns without the confusing medical jargon, subscribe for new videos every week. Next up, I'm going to go all the way back to the starting point for most patients navigating diabetes and reviewing metformin. You won't want to miss it. As always, this video is for educational purposes only and is not medical advice. Talk with your doctor or pharmacist before making any medication changes. Thanks for watching.